First, it is plugged in. The power is back here on the back. You turn it on, all these lovely lights will show up. If you have blinking lights here, there's a legend here that tells you why some of the lights are blinking. The majority of them is because it hasn't been properly set up or open and everything. So, see, everything is color coded. This is what you'll be using. You see all this up here. You will not need to do anything with the time that you see here. All you're doing is plugging things in, and that is it. This is your cryo probe, and it is color coded as well. I know you guys probably can't see this, but there's orange, blue, red, and black. So the first thing I do, turn it on. We open up the gas tank, which is down here, nitrous oxide, and you'll hear it fill up. You don't have to turn it. You don't have to open it all the way up, just enough for the gas to fill up. There's a temperature gauge back. I mean, not temperature, a PSI gauge back here. This is what I want you guys to focus on, not this right here. This will blink when it starts to getting lower in the nitrous oxide gas. But this over here will tell you basically how much you have in your tank. You want 700 or more PSI in this tank. If you have less than that, then the function of the probe is not going to work properly and your doctors are going to get pissy. You know how they are. If anybody wants to come up here and try this, you're more than welcome to. There is, in order to put the probe in, there's a little collar here, and you just push them back, okay? So I recommend you lock the cart first, because it'll be probably a little hard. I don't know if you guys can see over here, but push the collar back, insert the orange, push collar back, insert the blue. The blue's a little harder to do. There's your black and your red. And then I always just kind of tug on these a little bit just to make sure they're in. You hear that click? That's what I want to make sure. All right. So that blinking light went off. This little blinking light over here was just because the tank was not open. This little blinking light that you'll see is because the probe is not connected, so I don't want you to freak out if that happens. Everything is now set up. So here's your probe. Let's see, get it out a little bit more. This one's been abused, so it's a little harder to work. You are ready to go. There is a green light here. So whenever the doctor places it on the nerve, it says go, you just hit it, and it'll start freezing. And you'll see, you won't be able to see this because it'll be inside, but just letting you see what it does. So the purpose of this is they'll place this probe, the tip, on the nerve, and it freezes the nerve. And what happens is it detaches. For these patients that have a lot of pain, we all know that a thoracic incision is very, very painful. This detaches the nerve, and over the span of a month, the nerve slowly regenerates to get its use back. In that month, the patient that you guys have will feel no pain. So they're allowed to get up and move, walk around, do whatever they need to do, which is great for parents because as parents we all, don't want our child in pain. So this will cycle back through. I'm just going to pretend like the 2 minutes is up. So when 2 minutes is up, it'll go to defrost, which is yellow. It's already defrosted. It kind of just melts in here, and that way when they need to detach it from the tissue, it doesn't tear. And it's cycled back to green. So if he goes to the next one, you're ready to go. So it'll cycle back itself, so you don't really have to do anything. So all you're doing is turning it on, opening the tank, making sure you have enough gas, plug it in, color-coded, it's green, it's ready to go. They say go, you just hit it. Now if he says, wait, you can hit it again, and it'll cycle back. So right now it's defrosting. It has to expel all the gas out before it starts to go again.
So this is not something they can do on the handle to
No.
control it.
So once they, say they start and stop like that, how long does it take to cycle back?
Normally not this long, but it usually goes pretty quickly.
Where are they keeping the tanks, like leave them low?
So the tanks are down on the dock, and I am gonna get another tank to put on the side here. You get quite a bit of uses out of these tanks. It's a 20-pound nitrous oxide tank. This orange heater blanket that you guys see down here, I don't know if all of you can see it, it's basically like a girdle. And the purpose of that is to heat the gas from below the tank, and that's what defrosts the probe. And like I said, whenever you do not have enough gas in the tank, this is your temperature gauge. When it hits -40, your timer starts. If you do not have enough gas in there, it takes forever to get up to 40 and for this to start. Same thing, reverse. Once you start it, if there's not enough gas, it takes forever for this thing to thaw. That's why I tell you 700 PSI or greater. And then when you are done, first thing you do is just close the tank. And it's kind of hard, the way they constructed this. Turn it off, and then there are buttons back here. You guys can come up and see. There's 2 red buttons. It's hard to turn it. So, but you can, like I said, there's 2 red buttons. You just push the red button and it'll expel all the gas out for you. The reason why I say close the tank, because if you start expelling, you're expelling all the gas out of the tank because it's hooked up. One of them is this one. There's a mushroom back here, and if you pull it, it's a little harder, so I recommend the smaller red button. And they both have a little a little picture next to them that has N2O, and then the gas is doing this, so you know that those are the 2 to expel. Once you are done, then I would just unplug it. And it is done. That is it.
Pull the collars back again to unlock, to pull them out?
No, well, yeah. So just to pull them out, because the collars lock them, yeah. To dispose of the probe, you can either put it in the sharps container. I put it in the sharps container just because I don't want anybody thinking they're getting stabbed with something. And I try to retract it back afterwards, but sometimes it's hard to do because they have it bent. I think in these cases, they're not going to have them so bent like they use them in CV. So I just retract them. You can put them in the trash if you want. I don't want people freaking out. So let's see, what else? That's pretty much it. You guys have any questions?
So are we using the same unit for CV and general?
Correct, yes. We've tried to use it like 4 times already in CV, but they're complicated cases. It depends on, where you can get, to the heart, to the annulus. So we've tried 4 times, but haven't been able to use it. You guys have a lot of pectus repairs coming up. Yes. The first one, I think, is at the end of April, the beginning of May. I've already gotten 5. So, and you will use this. And just to let you know right now, we have a new probe out specifically for cryo nerve block. It's not on contract yet, but it's gaining fire around the U.S. with a lot of the pediatric groups wanting to use it. It's very specific for nerve block. So whenever we introduce that new probe, I'll bring that one to show you guys as well. So.
Is that a nerve block probe as well?
Yes. Mm-hmm.
Oh, okay.
And what about the wrench, the bendy wrench that comes in there?
You don't need it because that's more for CV because they have to make a tighter curl on it to go around pulmonary veins and stuff like that. This is just very straightforward. You can bend it with your fingers. Why do I always do this for? You can bend it with your fingers. It's not that hard. The probes. There are 2 probes that you have here at Dell. One of them is a Cryo F, the other one's a Cryo 3. For this, you need Cryo 3. That CryoF is a lot more malleable, and we use it for CV. So, I don't want you guys to get that confused.
And it's in a different location.
Is it? Okay, well, there you go. Perfect. Smart people.
So the ones for general surgery, it's by the ostomy bags, it's down there at the very bottom right now.
That's big old
It's
one.
about 3, we're gonna carry about probably 3 right now. I'm sure we're gonna increase that, but,
I will, and just to let you guys know, we want to be here for all these cases. That is our primary goal as a company, is to always be able to cover these cases, especially the pediatric cases. We want to be there for the doctors if they have any questions, for the staff if they have any questions. We want you guys to be able to do what you do, and we take care of what we do. So, yes.
I have a question. Are we using that before the case, after the case, during the case?
So you'll use it at the very beginning.
Before we even scrub, before we even prepare?
No, no, you'll be in the case. So they'll make the incision.
It's during
They'll
the case.
use the incision before they start the procedure. They'll
Right.
do the cryo nerve block.
But their patients are already draped.
Correct,
out.
yes,
Okay,
yes.
So during
Uh-huh.
the part,
Mhm.
okay.
Yeah, but you'll do it at the beginning of the case, and then they'll do the
When I
pectus
hear
repair.
before.
it's kinda like,
yeah.
it's kinda like replacing your epidural. So
Yes.
they're doing the epidural, they're doing this,
Yeah.
and then they take off.
Yeah.
And could go to another room if they need to.
Right.
So they-
But you already, the patients already scrubbed
Right.
and draped and everything.
Good question.
And for the nurses who are doing these cases,
That's what I'm-
please, when the patient is transferred to PACU or wherever they go, make sure you communicate with that nurse that the patient has had a cryo nerve block. I think one patient here got transferred without them knowing, and the nurses on the floor were like, what in the world? This kid is like Superman, running around, just had, incisions here, we don't understand, and I called. It takes about 1 to 2 days to bridge. Sometimes it bridges automatically, but when I called to tell them, they were like, oh, that makes sense now. So make sure you communicate that there was a cryo nerve block. The doctors know that it takes 24 to 48 hours to bridge, but because kids they're younger, their bodies, I think they respond quicker to this. Usually it's 24 hours or less. So they'll still do like some type of like, I don't know, Marcaine or Exparel or something like that, or yeah. Any questions?
Can you show me the PSI?
Yes. Let me turn it around.
Okay.
Our first pack test that we did, that's what happened to them, I guess it wasn't very good. Clearly, that the kid had IO.
This is your PSI right here.
You
can see it underneath.
And it should be 700.
700 or more.
Okay.
Yes. And then your 2 nitrous oxide plugs. One of them you just push, the other one you pull. And that one's really hard. That's why I always recommend this one.
All right, good.